Living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Pain and limited movement are the biggest reasons for a hip or knee replacement. But at what point should a person have surgery? Today we'll get the answer to that question and along the way learn all about hip and knee replacements, including the process, the risks, and the rehab. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Beth Brown. Stay tuned. Welcome back. Today we are talking with Dr. Kerry Hale about hip and knee replacements. Welcome to our show, Dr. Hale.
Thank you.
Thanks for being here. So let's just dive right in. Can you start out by telling us what is osteoarthritis?
Osteoarthritis is a degenerative condition that can happen to most of us actually as we age. It's just a regular wear and tear of the joints themselves. So the cartilage wears down.
Okay, so this is something that may lead to a knee replacement surgery?
It can, yes.
Okay, what are some of the other reasons why someone may need a knee replacement surgery?
Well, arthritis can occur from not only the regular wear and tear osteoarthritis, but inflammatory arthritis such as rheumatoid arthritis, gout, those types of conditions. People can also have what's called post-traumatic arthritis. So say an ACL or meniscal injury when we're younger can lead over time to what we call this post-traumatic arthritis.
Okay, and if someone is experiencing these kind of conditions or pain, is surgery usually the answer, or are there other alternatives that might come up?
There are definitely other alternatives first before surgery. Patients can go through physical therapy, strength training programs, modifying their activities. There's a whole host of different medications, both pain relievers and anti-inflammatories that we can use. And then there's certainly a role for injections in joints occasionally to help. So a number of different things that can be done.
Okay. And I know there are people, lots of times, they'll live for years with knee pain, or maybe their knee isn't as mobile as it used to be. What's the tipping point there where it's time to get them in for surgery?
So every patient is different.
Sure.
And every situation's a little bit different. I like to tell my patients that the time to consider joint replacement is when their pain and their dysfunction in their daily life is enough where they've had it, and they've been through conservative therapies, and they're ready.
And so there are different types of knee replacement that you can get, right? Can you talk a little bit about those different types?
Sure. So there's sort of what we call a full knee replacement. We divide the knee into 3 different compartments, and that's a replacement of all 3 compartments. And that's the most typical replacement that's done here in the United States and worldwide. There's another replacement called a unicompartmental arthroplasty, which actually only a small percentage of patients would be eligible for, because typically that's arthritis in just one compartment of the knee, whereas usually there's arthritis in more than one compartment.
Okay.
So.
Okay, are there, will someone who get this surgery just see vast improvements, or what is the improvement like once you have a knee replacement?
It's a big surgery to get through, and I tell people that they may wonder for the first few weeks, sort of after surgery, what they did get themselves into. The recovery time typically by about 6 weeks to a couple of months, 3 months out. Patients are doing fairly well, but with a knee replacement, you'll see small, steady improvements for an entire year after surgery.
Okay. And what exactly happens during knee replacement? Is there mechanical things that are put in there, or can you just talk a little bit about the procedure?
Yeah. So both sides of the joint, the femur, the thigh bone, and then the tibia, the larger bone in the leg, basically using a series of jigs, the arthritis is cut and planed off. So all of the cartilage is taken off, along with a small amount of bone, making nice, smooth surfaces for the implants to fit very precisely onto.
Okay, and you already talked a little bit about the recovery time and seeing improvements. Is there a typical time that people will expect, or does that depend on the patient too?
In terms of the recovery time, yeah, so typically about 6 weeks, 2 to 3 months, patients are doing quite well, and they're back to the most of the activities that they like to do. They'll continue to see, again, some small improvements after that for the first year.
Okay, and are there preparatory things that people need to do before the surgery to kind of ensure that that recovery takes place how it should?
So if patients can, what we call prehab, meaning if they're able to do some sort of strength training, weight-bearing exercise before surgery, it will help immensely in terms of speeding their recovery afterwards. Sometimes that's just not possible because if the knee hurts enough, then you're just not able to do much on it. But we try to encourage patients to be doing as much as they can in preparation.
Okay, are there times when people are experiencing these kind of pains or conditions but still wouldn't be a good candidate for knee replacement surgery?
If a patient had a significant other illness or illnesses where it may not make it safe for them to undergo anesthesia or pretty substantial recovery, those would be the instances where surgery wouldn't be recommended.
Okay, is age ever a factor?
Less so now, for sure.
Great.
So.
Okay.
It's really on kind of your overall health and instead of the age.
Because the age is only a number, as
yeah,
I always
yeah.
say. Exactly. Okay, we need to pause here for just a quick break. But when we come back, what else you need to know about knee replacement surgery, and we'll also take a look at hip replacement surgeries too. So stay tuned. We'll be right back after these messages. Welcome back. We're continuing our conversation with Dr. Kerry Hale about knee replacements. So thanks for sticking around with us, Dr. Hale. So just to continue that conversation, like we said, are knee surgeries, regardless of whether it's the full replacement or a partial replacement, are they always 100% successful with patients?
They're not always 100% successful. Knee replacement surgery is a very successful surgery, and somewhere 90 to 95% of patients are really happy that they had it done. But there's always complications that could go along with a big surgery like that.
Okay, are there things that patients can do to ensure that success rate?
I think the best thing to do, again, is to try to be as fit and healthy as you can be going into it. And then certainly physical therapy and doing the exercises that we need you to do after surgery plays a really big role in getting the knee range of motion back and the strengthening of the leg back after surgery.
Okay, and then how long does that new knee usually last for a person?
So we don't entirely know the answer to that. There's really good 15-year data out of the Mayo Clinic showing that at 15 years, 98% of all knee replacements are still functioning well. And the interesting part of that data is that it's data from implants that were 15, 20, 25 years ago. So hopefully the implants that we are using now, the surgery that we're doing now, will be even better, last longer.
Okay. Has there been times then where that 15 years has come up and somebody has been a good candidate for a second knee replacement, or does that not really happen?
That definitely does happen for a number of different reasons. and that's called a revision knee surgery. And those are successful as well, although the success rate goes down a little bit and the complication rate does rise a little bit with a second, third, fourth surgery.
Okay. And we were chatting during the break, and you mentioned that knee replacement surgeries are actually on the rise. Can you talk about that a little bit?
Yeah, they've definitely skyrocketed in the U.S. and worldwide. The number of people that are living longer and are more active as they're getting older has risen dramatically, and so therefore the need for knee replacements has as well.
Okay. And does health insurance usually pay for a knee replacement surgery?
Yes, they do. Sometimes there's different conservative treatments, medications, physical therapy, that kind of thing that needs to be done first before the insurance approves a replacement surgery.
But yes. If you go through that, then okay, great. All right, so let's switch gears, or joints, as the case may be, and talk about hip replacements now. What are some of the reasons why somebody might need a hip replacement surgery?
Very similar to the knee replacement. The most common cause is that osteoarthritis, wear and tear arthritis of the hip. Sometimes injuries can play a role when we're younger. There's an entity called avascular necrosis or osteonecrosis of the hip that can occur, which is the same outcome, needing to have a hip replacement, just a bit of a different mechanism of an injury to the hip.
So again, as we asked about knee replacement, are there other alternatives or options for folks other than surgery? That I know the hip obviously is a little bit different than the knee, but can you do physical therapy and things like that for that instead?
You can, physical therapy, anti-inflammatories. I typically don't recommend much in the way of injections for the hip. They don't seem to work nearly as well as they do in the knee.
Okay. Okay, and then are there partial hip replacements? Is that similar too, or are there different kinds of hip replacement surgeries?
There's what we call a total hip arthroplasty, which is what the vast majority of surgeons in the U.S. are doing. There's something called a hip resurfacing surgery, which has, for the most part, fallen out of favor because of the bearing surfaces that are used in that surgery. It's called a metal-on-metal hip, and most of us are not doing metal-on-metal hips at this point because of some issues that have arisen with them.
Okay, so what is used if it's not metal anymore then?
Yeah, so in a hip replacement surgery, the femoral head, or the ball of the hip, we take that out, and a stem, typically a titanium alloy stem, is used to, it gets inserted in the upper portion of the femur, and the bone grows onto the stem. And then either a metal or ceramic head fits onto that stem. And then there's again a titanium cup, which gets inserted into the pelvis, into the cup of the hip, and again bone grows onto the back of that. And then usually there's a plastic liner that snaps into the cup, and so the head articulates with the plastic liner.
Okay, wow.
Yeah.
So metal still is at play, it's just avoiding that metal on metal part.
That is correct.
Okay,
yeah.
Gotcha. Okay, and so again, at what point would you recommend hip replacement surgery for somebody who's experiencing pain or different hip conditions?
Yeah, so once again, it's when that pain and dysfunction is bothering people enough in their daily life. Hip replacements may last longer, and there's actually a little bit of a better patient satisfaction rate overall with hip replacements versus knee replacements. So patients that are a little bit younger at times with hip arthritis are offered hip replacement surgery, maybe versus a knee replacement surgery.
Okay, all right, great information. We do need to pause for yet another break, but there's still more to learn about hip replacement surgery. We'll continue our discussion with Dr. Hale right after these messages. Stay with us, we'll be right back. Welcome back. Dr. Hale is still with us as we continue to talk about hip replacement surgery. So let's talk about, you already talked about the procedure a little bit, but there are different approaches to the hip surgery. Can you talk about those a little bit?
There are. In the United States, there's two main approaches that are used now, about 50% each way. And there's something called a posterior approach, which most of us trained on. And then there's more of a newer approach called the anterior approach. And there's some different reasons why different people would get different approaches, and some pros and cons to both approaches.
Okay, so we talked a little bit about the recovery from knee replacement. What is the recovery like for hip replacement?
It's typically much quicker, actually, than the knee replacements. Okay. There's no specific physical therapy that I typically have patients doing after hip replacement surgery. I tell my patients that walking is their exercise afterwards. And really, by 4 or 6 weeks, patients are doing really well and kind of back to their usual activities.
Okay, and what's the success rate when it comes to hip replacement? Knee replacement's really high. Is hip replacement high too?
It is very high. Probably actually a little bit higher than knee replacement overall if you looked at all of the data from worldwide, really.
So close to 100%?
Close, yeah,
Okay, yeah.
I would say, yes.
Okay, that's great. Yeah. Okay, and so you said 4 to 6 weeks, that's a pretty average time that someone might be able to expect. Are there any times where there are complications where that might go a little bit longer?
If somebody had a really arthritic hip to begin with, sometimes if they had a big, what we call leg length discrepancy, so that leg would be a lot shorter than the other one from their arthritis. If their hip was really stiff before surgery, meaning that the muscles and tendons and ligaments around it all needed time to heal as well and become more limber after surgery. So in those cases, it can take a little bit longer.
Okay, and again, similarly to the knee replacement question, are there times when someone is just not a good candidate for hip replacement, or are there risks that they should know about if they could or could not be a good candidate?
And as with a knee replacement, it's mostly just overall health and being able to undergo an anesthesia from a heart, lung standpoint, that kind of thing.
Okay, and how long does a hip replacement usually last?
At least, hopefully at least 15 plus years. There's very good data out there to support that.
Okay, and are there times when people have had to do that sort of a thing twice too?
Sure, yeah, yep.
Okay, and so also asking, I know this is important for folks to know, health insurance, is a hip replacement something that they can expect their insurance to cover?
Yes.
Okay, that's good. Probably a relief for folks who are interested in something like that. And are there things that folks can do to make sure that hip replacement lasts as long as it should?
So I tell my patients that they can go do anything that they would like to do with their hip or their knee except run. And I think that running or high impact jumping activities, while you might feel like you could do them with your joint replacement, I don't think it's a good idea because I think it could lead to earlier wear of the joint.
Okay, so certain sports, things like that?
Yeah, I mean, I think people can hike and bike and swim. I allow people to downhill ski, play tennis, but a lot of running, basketball, high impact jumping, I don't think is a good idea.
Okay, gotcha. So let's back up long before the surgeries ever happen and just talk about somebody is experiencing either knee or hip pain. What do they do? What's their first step?
Oh, they can speak with their primary care provider if they'd like to. They can also call an orthopedist, either a non-operative orthopedist or an orthopedic surgeon. And our office, for example, you can call and make an appointment. You don't need a referral.
You don't?
No.
Okay, that was going to be my next question. So a referral is not required. You can just cut out the middleman and go straight to an orthopedic physician. Okay, and then if it is determined then that surgery is required, we've talked about, you know, hospital safety and surgery safety on this show before. Can we talk a little bit about infection prevention and some of the things that can happen in surgery as far as patient safety goes?
Sure. Infection is a really big issue in joint replacement surgery. It's a subject that has a lot of attention is paid to because infection in that setting is just disastrous for patients and our healthcare system. So we have patients go through a process using a special soap before surgery, checking for what we call MRSA before surgery, and then when they're in the hospital receiving IV antibiotics, special dressing that we use, just really paying very close attention and close monitoring for that.
Can you, I mean, this might seem a little bit obvious, but can you talk about the difference between an orthopedic doctor and an orthopedic surgeon and when somebody should go see one or the other?
Sure. The orthopedic doctor maybe somebody, a primary care physician with an emphasis in sports medicine or orthopedics, who they just see patients in the clinic, maybe do some minor procedures in clinic, versus an orthopedic surgeon who sees patients both in clinic and operates.
Okay, perfect. Thank you so much for your time and all your expertise. We're out of time. That's our show. So I'd like to thank all of you at home for tuning in this week, and we hope you'll tune in again next week. Until then, stay fit, stay well, and stay healthy for life with Healthy Living for Life. Have a great week.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.